Hello, everyone. Thank you for joining us in this webinar by Navigate Maternity. I am Dr. Elicia Harris. I am a board certified OBGYN, and I serve as the Chief Medical Officer for Navigate Maternity. And today we are going to talk about your blood pressure, all aspects of it. Why your blood pressure monitoring is important, what sets Navigate Maternity apart in empowering you with the data to monitor your blood pressure and improve your pregnancy outcomes. So this talk is titled Why Monitoring Your Blood Pressure in Pregnancy Matters. We want to understand the blood pressure cuff, the different diagnoses of hypertensive disorders in pregnancy, and especially preeclampsia. So with that, we will get started with the basics. What is your blood pressure? Your blood pressure is the actual measurement of the pressure within your blood vessels. So when one has their blood pressure taken, there are two components to this measurement. The first is the systolic blood pressure, and the second is the diastolic. And when you look at a blood pressure reading, the systolic is a number that's on the top, and the diastolic is a number that is on the bottom. So the systolic number is the actual pressure in millimeters of mercury when your heart is actually working, when it's contracting, when it's squeezing. You know, anytime you squeeze something, you're putting it under more pressure. And for that reason, that number is always higher. Your diastolic blood pressure is your heart in its resting tone. So that is in between the beats. So there's no squeezing on those chambers of the heart and no pumping actively of the blood through the blood vessels in that period of time. And that is why that millimeters of mercury measurement is lower. So monitoring these two different numbers, these parameters, components of your blood pressure during pregnancy is critical to catch early signs of changes to that. So let's focus now on the Navigate Maternity blood pressure cuff specifically. Navigate Maternity's blood pressure cuff is one of only two blood pressure cuffs in the market that has gone through FDA validation for use specifically in a patient population such as a pregnant woman, someone that is postpartum, and someone who has some type of hypertensive disorder of pregnancy, such as preeclampsia. Most standard cuffs haven't been tested on this specific patient population. However, ours has, which means you know that you are getting reliable, accurate readings and that your care team can truly trust. So what about our cuff is special that gives us this level of validation? So our blood pressure cuff takes your blood pressure 3 times in a row during each reading. This unique function helps to capture vasospasm. So vasospasm is when your blood vessels suddenly spasm or squeeze. And when that happens, you're suddenly putting erratic pressure onto the vessel, and you can get very sudden fluctuations in your blood pressure. Those sudden fluctuations in your blood pressure are what can cause those blood vessels to burst, which can lead to heart attacks, stroke, headaches, end organ damage affecting the kidneys and the liver. And so that's a true pathophysiology of preeclampsia. So normal blood pressure cuffs don't have this functionality, and that is how the Navigate Maternity cuff is different. So again, unlike chronic hypertension, where that process of the pressure within the blood vessels stays relatively stable or static, in hypertensive disorders of pregnancy, such as gestational hypertension or preeclampsia, you will have sudden spasms, sudden erratic changes in your blood pressure, and that truly is captured by our cuff. So, one of the things that I wanted to emphasize is who's most likely to be impacted by hypertensive disorders in pregnancy, or who's high risk for these things to happen, to put it in concise terms. So, firstly, to be older in pregnancy, advanced maternal age. Um, a lot of people don't like this definition. I fall into this category, so I can empathize with that. I would be considered a geriatric pregnancy if I were to have a baby right now. So I understand, but truly, after 35, we see a much higher incidence in preeclampsia and gestational hypertension. Being obese, having a elevated BMI coming into pregnancy that is 30 or higher definitely increases the incidence of that. Having gestational diabetes in pregnancy, having a very strong family history of either chronic hypertension, gestational hypertension, or preeclampsia. Also, just being a first-time mom, whether that's in your 20s, 30s, or 40s, with your very first pregnancy, the incidence of a hypertensive disorder in pregnancy is higher. Having a smoking history or a history of any chronic disease. And sometimes those chronic diseases are inflammatory processes or autoimmune conditions such as lupus, especially. Those patients are at a very, very high risk of having preeclampsia in pregnancy. Also, if you had to utilize in vitro fertilization or any type of reproductive technology, there's a higher incidence of developing a hypertensive disorder. And then lastly, Black race, which, is not a modifiable risk factor for most of us. And I don't, this risk factor for Black race is how can I concisely communicate how I feel about this? It's not our skin, it's not our genetics that makes us at risk. It's the systemic racism and the implicit bias that comes with having Black skin that makes us at a higher risk for developing things that become complications of pregnancy. So, if any of those risk factors are pertinent to your own medical history, you again have a higher risk of developing a hypertensive disorder in pregnancy. And you could benefit from our Navigate Maternity monitoring system and the educational materials that are within our app. So, our blood pressure cuff is prescribed by your provider. It is covered by your insurance payer. And we help you to track your blood pressure by reminding you to take your blood pressure on a twice daily occurrence throughout pregnancy and the entire year postpartum. Our platform is a app that is compatible with, the Android and the Google market. And with collecting your biometric data that lives within the app, and it also has the ability to show you trends of your blood pressure over time. So you could even look at things, in a monthly cadence or a trimester cadence to see, is my blood pressure progressively getting worse or is it relatively stable? It's very easy to share this data that you're collecting on yourself with your provider. And if your provider has integrated with our platform, we have an ability to just seamlessly transition your vitals over to your electronic medical record. It's important for you to check your eligibility when we talk about it being reimbursed by your or covered by your payer. And you can do that by just scanning that QR code there or going to navigatematernity.com. We also have a form there where you will fill out your pertinent information that's needed to do prior authorization, and we take care of all of the back end administrative work regarding that and mail your blood pressure cuff to you. And before I move on to talk about specific disease states regarding hypertension and pregnancy, I also want to mention if you wanted to just pay for the blood pressure monitoring system, out of pocket or utilizing a health savings account or FSA, you can also do that by just simply going to navigatematernity.com, shopping in our store, and you could simply purchase that, or you could purchase it for someone. I think that it would be a great baby shower gift for a lot of people. So let's talk about some of the specifications of the different diseases and how they're diagnosed. So chronic hypertension is your bread and butter high blood pressure, which your grandma had. It's the most common form of hypertension. And chronic hypertension exists prior to pregnancy or diagnosed before 20 weeks gestation. And for it to be diagnosed before 20 weeks gestation is typically that you're a young, healthy person who doesn't routinely go to the doctor for an annual exam. And so you didn't even know you had high blood pressure until you're now having these frequent prenatal appointments. And so chronic hypertension is not caused by pregnancy, but it can further complicate pregnancy. Gestational hypertension is a different type of disorder. This develops after 20 weeks of pregnancy. It's most likely to occur within the third trimester, and there aren't any long-term signs or symptoms of end organ damage. So it's more of a milder form of hypertensive disorders that develop in pregnancy. However, it is very much a slippery slope from gestational hypertension to the last category, preeclampsia. So preeclampsia can also develop after 20 weeks gestation. It includes high blood pressure with signs and symptoms, laboratory results that suggest that there is an occurrence of end organ damage, and it can lead to tragic outcomes such as having a seizure, which we call eclampsia, or a stroke, or a heart attack, or a liver damage, or kidney failure, or your blood losing its ability to clot. And all of those things can impact you definitely, and cause long-term morbidity, but they can also impact the wellness of your baby. And so for that reason, preeclampsia is something that is a very severe complication that we want to be an aid in early diagnosis and improve management um, at Navigate Maternity. So again, progression is can be a very rapid slope from chronic hypertension to preeclampsia or from gestational hypertension to preeclampsia. And that's why it's very important for you to monitor your blood pressure on a daily basis. And if you've been diagnosed with chronic hypertension or gestational hypertension, I really emphasize that you take your blood pressure a minimum of twice a day because changes can be very rapid and sometimes without accompanying symptoms. And as I mentioned, because the physiology of that is a sudden vasospasm or squeezing of those vessels, you can go from having a normal blood pressure to a very severely abnormal blood pressure in a matter of minutes sometimes. So we talked a little bit about signs and symptoms of your blood pressure being elevated, and I want to make sure I emphasize what those different signs and symptoms are. So one of the most common things is something that we also see in completely benign pregnancies, but I always put this on patients' radars because it can often be a very acute or rapid change in swelling of your legs, your hands, and your feet, where your skin feels tight. When it's hard to put your shoes on, it's hard to put your socks on. Can't even put your feet into your flip-flops because your feet are too tall. They look like a loaf of bread. Whenever I see patients with those type of swollen legs and feet, I really kind of get concerned about what is their blood pressure doing. Also, when we talk about swelling, that's usually accompanied by water retention, and that water retention and that fluid accumulating in the soft tissues leads to rapid weight gain. So someone who has preeclampsia, it is not uncommon for them to gain 5 to 7 pounds within a week. And so one of our offerings is also a Bluetooth connected scale that also syncs your data to our platform for that reason, to capture that acute sign of a development of a disease process. Another symptom is a persistent headache that doesn't go away with Tylenol. And we talked about the vasospasm, and the vasospasm, that spasming, the squeezing of those vessels. When that happens in your brain, that is the true etiology of why you have a headache. That's also the reason why some people can get changes in their vision, having blurriness in their vision, or seeing spots or flashing lights, or just like dark circles that kind of float throughout your vision. Those are often the result of having vasospasms in your brain, especially in the occipital lobe, which is here at the back, which is our vision center of our brain. Also, you may experience pain under your right breast, like in your right rib, upper rib area, which we call right upper quadrant abdominal pain. Your right upper quadrant is where your liver lives. So, our liver is a very large organ within our upper abdomen, and it is responsible for filtering your blood. And so there are very large blood vessels there. And if you get vasospasm there, that can cause pain. If you get swelling in your liver from preeclampsia, that can swell the capsule of the liver, and that can cause pain. And so that is also a concerning symptom to have. Also, shortness of breath or difficulty breathing. In the severest forms of preeclampsia, you can store fluid, not only in your skin or in your liver, but in the spaces, the air sacs of your lungs. And that can result in you feeling like you just can't catch your breath, or you just can't take a deep breath, where you feel like you're completely expiring or completely inspiring, to have that oxygen exchange. And then lastly, just having acute chest pain, acute tightness central in your chest, that can be a symptom of a heart attack. And so those can also be a result of erratic changes in your blood pressure. So any of these symptoms, if anyone experiences this, first thing you want to do is take your blood pressure. So, what is a high or elevated blood pressure reading? So, firstly, 130 over 180 is concerning. This is one step above normal. So it's in that mild category, but still for most people, this is abnormal for them. So this is an indication that something is happening and that you need to start monitoring your blood pressure at a consistent cadence. Then you've got the 140 over 90. This is truly elevated hypertension, gestational hypertension, or what we used to call mild preeclampsia. We now call it preeclampsia without severe features. So this is in that mild category. But if someone was to have the symptoms that were mentioned on the previous slide and a blood pressure reading within this 140 over 90 or above, that elevates you into the severe category, which is more concerning. And then lastly, a blood pressure reading of greater than 160 over 110 is severe range, and that requires immediate attention. And again, if it's in that mild category, but you have those symptoms, that is equivalent to just a frankly severely elevated blood pressure. So that also requires immediate attention. And it requires immediate attention, but if you're going into triage or going to an ER, but being evaluated by a healthcare professional with labs, with the physical examination, with serial blood pressure checks, because if you truly do have preeclampsia, you need to be admitted to the hospital, because we don't want something bad to happen to you. So again, I just want to emphasize how Navigate Maternity, with capturing this biometric data, we are truly empowering you, equipping you with the knowledge. We often talk about Navigate Maternity that we want to mitigate the implicit bias. What is implicit bias? Implicit bias is subjective interpretation of what someone is saying or what someone is reading or what someone is seeing. So it's not concrete evidence. Your blood pressure is data that is very much concrete. No one can argue with the numbers of a severe range blood pressure. And so, knowing these numbers, having this data, being able to see your trends, being able to concretely communicate this objective data with your healthcare team can help you be a powerful advocate for yourself. And it will also ensure that you are being treated with standard of care and evaluated the way that you should be and managed the way that you should be. And this is why this matters, especially for Black women, because we recognize that Black women are disproportionately affected by implicit bias and disproportionately affected by preeclampsia. And we often face very acute presentation of preeclampsia and usually have the more severe types of preeclampsia, more of the severe range blood pressures, more of the mild range blood pressures with accompanying symptoms. So knowing the signs, knowing the symptoms, and knowing your blood pressure numbers is truly a powerful step in saving your life. I want to remind everyone that your voice matters, your numbers matter, and your life matters. Some of the references that I use to help prepare the content of this presentation is a study that was in the American Heart Association pertinent to our blood pressure cuff, and also just common obstetrical gynecology literature, such as our practice bulletin on hypertensive disorders of pregnancy and preeclampsia. And so we finish 3 minutes early, and I will open up the floor for questions. Um, as I look into the chat, want to just remind everyone to contact us, to follow us, connect with us on our social media platforms and our YouTube channel. We will post this webinar to our YouTube channel for your ability to view and review and share. And also, we post additional content on our Instagram, TikTok, and Facebook. So these are those social media accounts.